One of the things that presently I think is super helpful for chiropractors really kind of came from your father and Dan Murphy in those early days, and it's the flexion extension view on cervicals. We use it in our office because I think it's a good mile marker about when the patients get a little bit bored, maybe it gets a little stale in the care. We'd like to use that flexion extension model about 90 days in because it really keeps the patient engaged in the process. And I think that's huge. I love talking about new patients. I'm known for that, but I really love the idea of keeping lifetime patients. Retention is huge. And so let's transition into what that study is called, the flexion extension, and kind of how that can tie into a year's worth of care, which is year or lifetime, and what it is that you do with curve correction. So talk me through that.
Yeah, so my dad and Dan Murphy, when they trained under Pettibon and then they opened their own practice in the 1980s, they were reading an author by the name of L. Pinning. And Pinning wrote some things in the 1970s in the peer-reviewed literature, and he was out of Europe. And he was doing flexion and extension analysis, and of interest, he was doing, basically templating of the posterior body margins, which is what my father was also doing to analyze the segmental angles of curvature that we call relative rotation angles. Pinning was doing it on flexion extension films. So they said, you know what, this makes perfect sense. In addition to looking at the alignment of the lordotic curve on static films, we've got to look at the dynamic or kinematic in positions on these flexion and extensions to make sure that the segmental angles are inside their normal range of motion. And so, they of course looked at the literature with White and Punjabi's textbook that came out in the 1970s. And there's limits for how much each segmental angle can go when we do these templating. And the limit is 11 to 12 degrees of flexion at any relative rotation angle using the Pinning method or using the posterior body margins that we use now. That is an instability cut point. That means your neck is moving too much. Right. So it was a true validation of instability on flexion extension films.
Right on. And what's cool is it ties right back into subluxation correction and being able, from a patient education standpoint, I use it to teach patients what's working and what isn't.
Yeah, that's right.
And I think when it's done right, you can pre-frame it as the teacher, doctor means teacher, to really show the patient, and very simply, they can tell me the answers. And when you engage in patient education that way, they can see their pre-X-rays and the lack of subluxations, and then they see the post, and it's a motion study, flexion extension. I teach this stuff in a 2-day workshop. I think it's brilliant to get the next 9 months worth of care for people to stay on for the full year. But at 90 days, you take a look at that and go, here's where it is. This is work your father and Dan Murphy did, and it's reproducible, which is what I love. And then we can go on for maybe another 9 months of care if that's necessary. How does that Pinning study, the flexion extension, tie into curve correction, which is what you're known for?
Yeah, this is great. And there's a lot to this, so interject with me, Brad, if you need clarification. Cool. So this goes back to your original point that CBP technique sometimes is not just a technique.
And I love that. I love that.
Yeah, the reality is it works with any segmental technique that you will allow CBP to work with. So on a flexion extension series, if I see movement in joints that is A, not enough, or B, is too much, segmental techniques are going to come into play. And it doesn't matter what technique you use. You've got to get the joints that aren't moving to move, right, and you've got to back off the ones that are moving too much. That's just the reality. Well, here's where CBP comes in. We know that the sagittal plane alignment of head posture and the curvature in the neck dramatically influences flexion and extension kinematics. That's well known in the literature. It was first reported in the 1980s by Punjabi et al. And in fact, it goes way back even further than that. The early 1900s, a guy named Lovett came up and showed that flexion extension movements in the cervical spine are driven by the alignment of the sagittal plane posture. So we know that the curve in the neck...
I'm going to stop you right there because this is a really good learning point, and I know the answer, but help me understand what sagittal plane global abnormality would impede flexion extension.
Yeah, so anterior head translation is the classic, right?
And does that happen frequently in today's world?
Oh, geez, yeah, you know that. Yeah, it's it's extremely common forward head posture, and the reason is when your head goes forward, way forward, the upper neck is going into forced extension, the lower neck is forced flexion, and so now there's not enough slack in the tissues to be able to do a proper range of motion. It's
Right.
just the way it is, and
Which is
so
happening all the time, right? So
that's right.
I'm gonna hit pause right here because this is a very inclusive conversation. Whatever technique
Yeah,
you practice, whatever segmental readings you get, it's necessary. And if we've got
that's
a
right.
global change like forward head posture, the whole FHP, where the
Yep.
head goes forward, not only does it affect the cervical spine and the tissue that goes with it, but I'm just going to talk real quickly off the spine. How does that affect the glenohumeral joint and the range of motion there? What does that do?
Dramatically. The cervical spine is connected to the shoulder girdle, not just through basic anatomical connections, but through gross postural movements as well. So your head goes forward, the shoulders protract, and the glenohumeral joint internally rotate.
Right.
Now you're not going to have enough range of motion in that shoulder. You're going to end up frozen shoulder syndrome, etc.
Totally.
Yep.
So this is where it's just so elementary, but I really want this to be a great learning experience. With all forward head posture patients that I've seen past a certain point, the GH is always involved. The shoulders
Yeah.
always have problems and limitations. What I love from a patient education standpoint is telling the patient that I know that without having them share the information. Geez, I'm looking at your posture and I know you must be having shoulder issues because it rolls in, it shuts down your range of motion. That's the least
That's right.
stable joint in the body. It's the most mobile joint in the body. However, you've lost your mobility because of what's happening. And they just kind of go, holy
Yep.
smokes, So there's just some really, really intuitively smart stuff CBP does. And again, it honors and is inclusive of other segmental dysfunctions. But when we start looking at this flexion extension, it just makes sense, right? The head goes forwards, so upper cervical goes into extension, and it completely
Yep.
jacks up what's going on there. So
That's right.
keep rocking.
Totally right. And so then, we've actually done a couple randomized trials where we've shown that just by correcting the alignment of the cervical curve, so somebody comes in with a straight neck or a kyphotic neck, we correct that cervical curve with CBP rehabilitative techniques, which is traction and exercise and mirror image adjusting. So we correct the curve and we show statistically significant improvements in flexion and extension segmental kinematics. In fact, it's linearly correlated. The exact amount of curve correction is correlated to the exact amount of change in segmental rotations and segmental translations.
That's awesome.
We just published that RCT this year in the Journal of Back and Musculoskeletal Rehabilitation. So we know when we have altered flexion and extension kinematics on my flexion extension series, we know it's also related to the cervical alignment. The two go hand in hand. You can't do statics without dynamics, and you can't do dynamics without statics. And this is where CBP fits in with all techniques.
I love